PT is a licensed doctor of physical therapy with 5 years of experience spanning pediatrics and women's health. Passionate about equity and education, she mentors women of color navigating physical therapy school and serves with Operation M.I.S.T, a women's health organization focused on addressing the maternal health crisis. Her commitment to women's health is deeply personal. Her own journey to find the right clinician and membership was life-saving for both her and her baby. That experience continues to fuel her mission to educate, support, and advocate for women across all walks of life. Dr. Quinn remains dedicated to growing in her profession and in her faith, bringing compassion, insight, and a spirit of service to every space she enters. Please welcome Dr. Quinn.
No questions. Just joking. Can everybody hear me? Yes? Okay. I know it's almost lunchtime, so like if you get hangry, don't take it out on me on the questions later. Just bear with me as well. Okay, great.
It's so nice to meet you in person. Come on up here.
Okay. All right, awesome. As he said, my name is Amber Quinn. I am a physical therapist. I've been a physical therapist 5 years in October, so not as long as some of you guys have been practicing what you've been doing. I'm still a newbie, but I have a little bit of experience in pelvic health or women's health, and I also work with children. I like to say that's really my job. I'm really a pediatric physical therapist. I work in the school setting, but I also do outpatient, and I also did a lot of like neonatal type stuff with mothers who had just had babies. So I like to work with mother and child, especially if they had like CP or something like that. So it's kind of joint. So I love moms and babies, but I mostly work in the school setting currently, but I do still treat women with pelvic floor issues as well. I met Dr. Catherine Sylvester, who is, well, I think is the creative genius behind Operation M.I.S.T, which is what we'll be talking about today. She could not be here today, and she asked me to do her a favor, and so here I am. So please, if you have any questions, I will definitely tell you to give Catherine a call. No, just joking. You can ask me anything. She trusted me, so I really appreciate her for giving me this opportunity. We're both physical therapists, and so today's talk is going to be about the role in physical therapy as a part of the team. We haven't talked about physical therapy at all. I don't think you guys have even mentioned PT, OT, any sort of rehab profession since we've been having these conversations, and I think that that's a good thing because I'm hoping that I can bridge that gap today. So right now we're going to be talking about the role of technology and physical therapy in the maternal health aspect. So the goal for today is to prepare women, well, the goal for Operation M.I.S.T. So M.I.S.T actually stands for Monitor, Intervene, Survive, and Thrive. So what we like to think of is, I'm saying we because I'm a part of Operation M.I.S.T as a monitor, but I'm also a monitoree. Yes, so I also wear the technology as well. So we would like to prepare women for physiological changes that are going to take place when you become pregnant and after delivery, reduce the occurrence of preventable complications. We've talked about how things have been up to 87% preventable deaths. So that's kind of our goal as a company, to teach women to use their vital signs. We're going to definitely be talking about blood pressure cuffs and other types of technology, and to help women modify their activities. So that's really the biggest thing about monitoring. As a monitor for Operation M.I.S.T, we don't use a lot of like lab values that are the norms for the nation, right? Because every woman is different. So the beauty of monitoring is you have a baseline of that particular woman. So if I know that your heart rate is usually this, and then this week is this, now I have a cause for concern because I've been monitoring you and not comparing you to what is maybe listed in research. And then we also like to teach women how to handle their babies and move with less pain following a cesarean delivery. So how it works is we connect with moms who are maybe aspiring to be pregnant or already pregnant and a year postpartum. And we use a nice little watch like this. It's just a smart watch. I don't know if you guys have heard of the Garmin brand of devices. Yes, they're popular. They're in Best Buy. That's where I get mine from. We use something similar to this where it calculates the O2, your sleep patterns, your breathing patterns, the typical stuff that the watches do, and they're all competing against each other now. Apple has like the blood O2 and the abnormal rhythms and things of that nature. And then we interpret the data. It comes up on a screen where you can compare the sleep, the O2, your sleep quality, not just the sleep hours, the stress, the body battery. We're going to get into what some of those things mean, but steps, which is the kind of general concept of most of the smart devices. And then between mom and monitor, there's not just a one-way outreach. They have access to us via a secure portal of text messages or emails. But if they do want our personal numbers, that's not opposed as well. But we like to keep it very secure, because some people, we don't know their home situation. We don't know their domestic situation. We don't know what they're going through. And so we want to make sure that everything that they're saying to us is private and that is secure. So, and then we interpret the data, we talk to them, we connect, and then we just do it all over again. So why Operation M.I.S.T works? It allows moms to be monitored through multiple stages of their pregnancy journey, or even pre-pregnancy and postpartum. And we're able to detect problems sooner via daily monitoring. So usually, as a monitor, we usually check moms. So I had a mom just deliver literally 24 hours ago. And I texted her at 9 p.m. because she was going into labor. Her water broke 9 a.m. So we were texting all day, right? So sometimes you monitor throughout the day. But sometimes, for the most part of your kind of first trimester, second trimester, no complications, no hardships. We kind of just do a top of the day or the bottom of the day. You kind of look at their day, see how it was, how was your stress, and I'd reach out and say, hey, it looks like you had a rough weekend because your stress was high, you didn't charge very well, and your sleep quality was a little awful. And then we'll talk about it and we'll make adaptations, and then they'll say, oh, thank you for reaching out, because to them, it was just a rough day, but your body will tell you how rough of a day it really is, and that's the beauty of using that piece of technology. It provides consistent support with outreach and education. So throughout the months, Operation M.I.S.T also hosts workshops and what we like to call educational in-services, if you will, where we talk about different topics, perinatal massages, how to prepare for that, consultations for nursing, breastfeeding, how to get dad involved or your partner involved, just things like that. It's not just monitoring and we never talk to the moms ever again. We have workshops once a month, and we talk all the time, and we have group chats. It's like moms everywhere, pregnant moms and babies everywhere. We share pictures, and moms can be monitored anywhere. And I think that's what's really important as we talk about being in a rural health setting. You don't need to be close to a provider or a monitor to do anything. Right now, the young lady that just gave birth, I think she lives, is it Bainsbridge? I'm sorry, guys. I am actually from Atlanta, so I actually do not know anything about what's south of Columbus. Bainbridge? Okay, yes, Bainbridge. Yeah, I've never been there. But I monitored her, and she's fine. Her baby's here. So numbers since April 2021. This is actually, I just told you we just had a baby, right? So, and I just found out I'm pregnant. So some of these numbers are not accurate, but they're pretty close. This was as of, I think, March. So we've had 32 general health people come, and I'm not going to call them patients. So if I accidentally say that, I'm sorry, because as a PT and as other health professionals, you know that we're licensed in one state unless you have multiple licenses. We cannot cross state lines. And so that's the beauty of being monitored by a health professional who also has other networks of professionals that they can access. You can still get knowledge and be consulted and be educated without actually being treated. So that's something that's great. So general health patients who are looking to get pregnant, 152 pregnancies and 92 women postpartum. Some women join Operation M.I.S.T after they've had their kid. 45 issues have been caught between visits. 75 complications and unnecessary interventions have been averted. and there have been 143 vaginal births. Oh, there was 2 babies. The last 2 weeks ago, I had a note. I just forgot. She had her baby at home, and it was not on purpose. And we were laughing about it because I was like, I think Catherine told her, and I told her, I said, having a baby is not like a DIY project. Like, you should have probably made it to the hospital. But it was fine because we were monitoring her throughout labor. And then when she was about to go into the car, we just kind of assessed like, well, you're already feeling the head and, you're trying to push, you might as well go back downstairs, finish what you're doing, and then go. So because it was a little bit more risky to get in the car. She's also in rural Georgia, don't know the name of that city either. And we had 1 low birth weight child. I also put this on the presentation. There were 377, they're called more than a period party ladies. If you have any questions about that in particular, I know that young lady that just went, ooh, she knows all about those, but basically on our cycle throughout womanhood, we experience different things, right? So you start a menstrual cycle, and then you go through menopause, right? So there's perimenopause and menopause and all these things and stuff. Those parties are just to give more education and encouragement about how your cycle changes and how you change throughout your life. I think the youngest participant has been 4, and the oldest participant has been like 81. So, all right, so everybody gets an individualized support. So we talk about diet modification. Each operation Miss Mom can look to see about exercise and activity modification, work modification. We're telling moms to get off their feet if their stress is crazy. We basically do a lot of just education and advocacy for them on the back end, because we can see things that maybe a doctor won't see, right? So if you're going to an appointment, correct me if I'm wrong, when you go to an OB, if you're normal pregnancy, typical pregnancy, you're going what, once a month? Is it? No? Up until a certain time. So the time in between that, nobody's calling you to check in on your sleep and all these things unless you have a big team of a doula or a midwife or whoever else, maybe your friends, a nurse, right? Nobody's checking in on your sleep quality, how many steps you're averaging every day, what you're eating every day. Nobody's doing that. So we're hoping to use this kind of thing to step in to do those things. Glucose management, blood pressure and heart rate regulation, energy conservation, and connecting with community resources. I know Operation M.I.S.T has partnered with so many companies and organizations to help give that transportation or send meals to moms or provide that level of that gap, to bridge the gap between when they could go to an appointment or maybe they couldn't make the appointment, or hire a babysitter. I know that Catherine has done that as well. The monitors, we have done some untraditional things, but that's kind of what this is about. It's about untraditional care. So remote monitoring and decision support has helped women get off blood pressure medications, detect pregnancies early. Yes, that just happened. Catch infections, preeclampsia, sleep apnea, identify abnormal hemoglobin, thyroid, iron, vitamin B and D levels, manage blood pressure, vital healthcare providers to their team. So I'm going to stop there. So I know for a fact one of the mothers that I've recently, she just had her baby in January. She didn't know that she needed a psychologist, but she needed one. And so we had those conversations because of some of the private conversations that we had. So as a professional, as a medical professional, that's still our responsibility, whether she's a patient or not. So we've been able to provide some of those healthcare providers information and contacts. Okay, so this is what you're supposed to learn. I think I've already started hitting on a few things, right? But you should be able to name 3 tools every birthing person should have to identify major causes of maternal death from home. And we're gonna learn a fun fact about that. Actually, identify 3 providers or resources that you didn't think that you might need, that you need to add to your team. Discuss 2 vital sign changes that could be used to detect pregnancy-related complications, and explain the role of remote vital sign monitoring and physical therapy after some of these complications listed here: severe blood loss or hemorrhage, hypertension-related disorders such as preeclampsia, and unplanned cesarean deliveries, pregnancy losses, or severe perineal lacerations or tears. So we've already talked about the maternal mortality rate here in the United States plenty of times today. Unfortunately, we already know these numbers. We just talked about the 43 to 365 days postpartum. That number is scary because it's the exact same, it's higher than the one that's during pregnancy. So that means that we're lacking some of this support when mothers are leaving the hospital. And that's going to be scary because that means we're leaving behind other children, the current baby, their partners. We're just losing too many mothers postpartum just because we're not monitoring small things that could be life changing. Okay, so general accountability measures. So we like to kind of preach some of these things. I do this every month. So every month we have to give them a M.I.S.T summary. So after a month, we look at your data and we say, hey, this month you had this many steps on average. This was your sleep quality on average. This is this and that. And then we'll talk about what we need to change. So I might need to say, hey, you need to be a little bit more active. And if you have some issues with your blood sugar, maybe we need to implement walking after meals. When I was pregnant, I had gestational diabetes. I didn't need to be medically managed with drugs. I only needed to go walking after my meals. But I didn't know that because until we kind of did like a test run. I was like, well, I don't want insulin and all these things. And so we decided to, with my monitor, and I was like, can we test out this? So of course I had some pizza and some wings, and then it was like the worst meal I could eat. And it spiked my blood sugar, but then I went on a walk, 15 minutes, and went drastically down. So I just had to add that into my routine, but I wouldn't have known that because when you get certain diagnosis in the setting, you're in that setting. You're at rest, they give you that little drink, and that's what it is. But that's not real life. Real life is me on the recliner eating pizza and wings. I need to be walking during the commercial breaks so that way I can make sure that my blood glucose doesn't spike. Avoiding fast and frozen and packaged foods, checking temperature, heart rate, and stress, and asking for accepting help. So some women are not willing to accept help. And so hopefully we're helping them bridge that gap a little bit better. So this data up here, we're going to focus a little bit on the blue number. So this is not a bad situation, but this is what it looks like some days. So she was pregnant. During pregnancy, her steps were 3,200. A week after delivery, it was a little low, which is expected. She's resting. 2 weeks after delivery, she said, okay, I'm gonna go run errands. She did that. And then her resting heart rate was 54 and her max heart rate was about 110. That's not too bad. But her stress jumped up significantly. So during pregnancy, it was only 27, and then only a week after delivery, it was 21. So that's a little bit alarming. And her body battery, which you can relate your body battery to your phone battery. So we charge every day, and that's what we're supposed to do when we recover, when we sleep. And so her body battery just 1 week after delivery was 92, and then 2 weeks after delivery was only 75. So that means the quality of sleep, as you can see at the bottom, was much lower than what her typical was. Again, we compare what they have for today against their norms, not anybody else's, because there are some moms that I monitor, their stress never leaves 50, and they're having a great day. That's good for them. And some moms, their stress never goes above 20, but they're fine as well. So we had to tell her, hey, look, slow down. We ended up calling her, seeing what was going on. And she was just like, oh, well, I was already out and I was already doing things. So I just kept doing more things. And it was like, don't do that again. Maybe you should just slow down a little bit. You know, she was like, I feel good, but that's good. But sometimes we might get into our new routine or our old routine too fast. So that remote monitoring is very helpful to notice that. Some of the major causes of death, as we've already discussed earlier today, are heart conditions, what we just finished listening to. Infections, severe blood loss or hemorrhage, blood clots, and high blood pressures are basically preeclampsia. So here are your tools that you need at home. Okay, let's say you don't want to be a part of Operation M.I.S.T, you don't want to have the watch, and you think, oh, I'm going to be fine. Everybody needs a pulse oximeter, a thermometer, a tape measure, and a blood pressure cuff. I skipped smartwatch because for these tools, everything is less than $100 collectively. And you can go to Walmart and get every single one of those things. So when you're talking to your patients or interacting with a client, or maybe you're talking to somebody that you know personally and they're pregnant or attempting to be pregnant, or maybe they just have health issues, they need to have these things at home. Outside of the smartwatch, this stuff can be acquired today. And this can be given to somebody because you need to be checking your blood pressure on a daily basis, sometimes twice a day. We need to be checking it after activity or at rest so you can have something to compare to. You need to have a tape measure, one, because we need to be monitoring swelling, changes in scar tissue, like lengths and sizes, anything like that. A thermometer for infections and a pulse oximeter. We just talked about how if your pulse ox is less than the pulse ox reading is less than 96% or less than 94%. I don't have it right in front of me, but the chart says that you are at risk for cardiovascular disease. How would you know that if you don't have a pulse ox? The smartwatch is just extra to monitor your steps, right? And to monitor your sleep, but that's effective as well. Because if you're sleeping, you're laying in the bed 9 hours, but you're not recovering at all. You never reach a deep sleep ever, right? Or you're laying there, but at 9 hours, only 3 of those hours were recovery type sleep. That means you don't need to be getting them doing a 12 hours types a day, right? So these tools are very important. So when things go wrong, we help moms get help so minor issues don't turn into major complications. So that's really the core of what this is all about. When we use technology and these tools and we use the smartwatch, it's really just because we don't want the case that I just showed you. We didn't want it to be like, oh, well, you know what? Her heart rate was fine. You know, her steps are good. Everybody's like, oh, she should be getting great steps, right? But her stress was crazy because that was not her average stress. So we don't want you so outside of your norms and outside of your typical that you're putting yourself at risk for other things because her blood pressure could have spiked or anything like that. And that could turn into, because we already talked about 43 to 365 days later, that was just 2 weeks postpartum. So if she would have kept that up, who knows, her blood pressure could have spiked and we could have had worse issues. So some of the big issues that we usually see are preeclampsia. If you don't know any of the signs, some of the major ones are listed here. There's a rise in blood pressure, foaming urine, that's just with like lots of bubbles. Those bubbles don't really go away. Severe headaches, changes in visions, floaters. Floaters is a big deal. Sometimes moms, they want to take, I just learned this fun fact. Moms will take a hot shower either after having a baby or right before they're due, and they'll say, yeah, but it was just really spotty. Like, they're like, oh, it was like black things or whatever the case is. That is a red flag. Like, they need to be in the hospital ASAP. It's a really big deal. I know a lot of people kind of just look over that kind of stuff, but light sensitivities, things like that. Upper abdominal pain, nausea, vomiting, decreased urine output, shortness of breath, and a sudden weight gain and swelling, particularly in the face and hands, as well as after you've already given birth and you still have a lot of swelling and weight gain. Those are things that you need to be looking out for as well. They still kind of balloon faced a little bit, and you're like, man, didn't you have that baby like 4 weeks ago? You might want to, have those questions, ask those questions, and maybe use that screening tool that was just presented to us. So this is one of my moms that I monitored that just had the baby in January. She, no, it was Christmas. You guys, I monitored so many moms. But anyway, she didn't know she was she had preeclampsia, but we were like, hey, check your blood pressure. She was like, okay. Then she told us she was having floaters. We were like, okay, check your blood pressure one more time. 5 minutes later, it went up. It went from 155/96 to 160 to 104. And then so she went to the hospital. They put her on bed rest. Of course, what happened? Her blood pressure went down, right? She's laying down. She's not doing anything. And this is where PT and all this comes into play. I love physicians. I love nurses. I love what you guys do in those settings, in the urgent care settings too as well. But what we tend to do is we forget about the active portion of monitoring a patient's vitals. When you're sitting in a chair, your vitals can be amazing. As soon as they let her go, her blood pressure went skyrocketing again before she could even get out of the car and get home. She had to turn back around and go back to the hospital because she was not tolerating being in a dependent position like this, standing. moving, twisting at the trunk, anything like that. She couldn't tolerate any of that stuff. And you're not going to be able to understand that if you're not doing a mobility assessment. So those kind of things need to be happening more frequently in the hospital settings and things like that, where we're maybe testing a woman on the stairs. Does she have stairs at home? We need to be testing her on the stairs. She's not going to ride the elevator at home. She's going to go upstairs. You can't tell her not to go upstairs. You're going to tell her to be on bed rest, and she's going to do what she wants. Okay, so we need to be monitoring her and preparing her to make sure, like, okay, well, if you feel like this on the stairs, well, how are we going to navigate the stairs? How are we going to navigate carrying groceries? Everybody doesn't have support the way that we want them to have support. Anyway, so she had a natural induction at 38 weeks after being in the hospital for 24 days. We sent her back home. We sent her back to the hospital. When she went home and we had this whole conversation, it was crazy. It's like me and Catherine on the phone, and I was like, Catherine, she shouldn't be at home. She's like, I know, we should tell her. And we were like, how are we going to tell her? Because you don't want to be away from your family during the holidays. And especially, you were not planning on being diagnosed with preeclampsia and all these things. But she went back, she stayed for 24 days, and then they discharged her the next day after she had a baby. Guess what happened to her blood pressure? It spiked again. It was wild, because I couldn't believe that they discharged her just because she was like, I want to be at home for Christmas. We can't let those things happen. We know that, patients are going to make decisions against medical advice, right? But at the end of the day, using a monitoring system and being in contact with other care providers, maybe like team members like a PT or OT or anything like that, saying like, hey, we're discharging her against medical advice, but, well, she's discharging herself. Can you please let us know what's going on? Something like that. So that's what we're trying to help build here as a team. And her quote is down there. She said, I thank you guys. Without you and the watch, I wouldn't have known I was in preeclampsia. She was very proactive as a mom. She would have definitely found out. She was one of those moms that texts us every day. Signs of too much blood loss is another issue that we see a lot outside of preeclampsia. So change in vital signs more than 15%, or a drop in blood pressure below 85 or 45 millimeters. Why am I trying to say what millimeters per? Is that mercury? What am I doing? Yeah, look at me. Yes, okay. Increased resting heart rate, finger oxygen reading less than 95%. So I think if we can take anything away from this, we already know that a blood pressure cuff and a pulse ox is going to have to be standard. Dizziness, shortness of breath, soaking more than 1 pad per hour. So they tell you that when you go to the doctor, like, oh, don't soak up a maxi pad, or you go through so many maxi pads, but you really have to start noticing other numbers as well, especially when we're talking about hemoglobin values, because typically you're going to go down 2 decimals anyway, 2 grams or whatever, if you have a cesarean. That's typical. And then let's say, you went down a little bit more because you lost some more blood. They're not going to really say, oh, you need a transfusion or you need something like that, unless this is from what I've experienced. I'm not sure if this is practiced everywhere, but what I've noticed is if it's not closer to that below 8, almost 6 number, they're like, oh, we're not going to push for the transfusion, but you could still be having issues of blood loss, because if it's slowly, you're slowly losing that fluid, it's still going to make an impact on your heart. So here's an example of that blood loss catch that we had with a client. So as you can see let's look at her heart rate. So her max heart rate was beautiful during pregnancy and a week after pregnancy, and then look, 3 days after birth, it went up. And then her stress was fair during pre-pregnancy and then a week after, and then look, it skyrocketed. And then the 2 key ones at the bottom is the blood pressure. Look at that blood pressure drop. That blood pressure drop with that max heart rate is an indicator of significant fluid loss, blood loss, for sure. So being able to see this, but then they were saying, oh, your hemoglobin's fine. She kept saying, I don't feel well, I don't feel well, I don't feel well. The purpose of Operation M.I.S.T and to have other people in your corner outside of a PT or a doula or whoever is so that way you can you already have your own knowledge. So if you know your numbers and you're like, no, I know my normals, and you guys don't know my normals, I know my normals, you can empower yourself to say, you know what, I want to be tested. I want to get tested one more time. So that's exactly what she did. They were trying to get her to go home, and she refused to leave the hospital. And long story short, they ended up testing her again. Her hemoglobin was super low. It was at 5.1. Okay, that's really bad. She was literally about to sign the discharge papers, you guys. This was not like she was still in the hospital gown. She was almost gone. And anyway, she just needed that extra support. And so they were able to kind of help her get back to where she needed to be. So there are plenty of testimonies like this as far as moms go in our community. And that's really the point of it all. When we monitor against their normals. I don't compare any of my moms to each other, because if your blood pressure is always running at 125, then over 80, then that's what I'm expecting to see. I'm not expecting to see you at 110. I'm concerned. Even though that's good on paper, I'm not expecting to see that, because why? Why did that change, right? Did you stay up late with your husband last night? You know what I'm saying? What did y'all go to a concert? Those are questions I ask, because that happens. Sometimes it was just you went to a birthday party and then you went to a family reunion. But if you have no explanation and all you tell us is, oh, I was sitting on the couch, then these are concerning. And then here are some signs of heart failure, which is something that we were just discussing. Shortness of breath, extreme tiredness, chest pain. But most of all, this is what I wanted to show you guys. So the steps pre-pregnancy of this young lady was 5,400. 1 week before pregnancy, she slowed down a lot. But 5 days after at home, she was around what she was before she was pregnant, while she was pregnant. Before she was pregnant. Well, before birth, right? And then resting heart rate, it went up. So pregnancy, her resting heart rate was 63. A week before she gave birth, 69, but it went up. Then her max heart rate skyrocketed, and then her stress skyrocketed. She was able to maintain a good level of stress pre-pregnancy and during pregnancy. And then look at her body battery, not even charging at all. So why is this young lady not charging at all? And listen to her hemoglobin numbers. So she requested her hemoglobin being taken at the hospital and get a follow-up, and it was right at 8. And her total sleep hours, of course, they were low, but look at the quality. So the quality basically it went half. This is a fluid overload catch for sure that could have turned into heart failure. This young lady was me, and I had this watch on, and Catherine called me, Dr. Catherine Sylvester called me, and she said, what are you doing? Why is your heart rate at it was like 160 at one point? And I was like, I'm sitting in the bed. And I was like, my heart is pounding though. I said, I can feel it in my chest. I said, I'm just sweating really badly. And I had sweat through like maybe three shirts. I'm stubborn. I was like, there's nothing wrong with me. I'm hot. Like, I'm just hot. They kept telling me, you're pregnant. You just had a baby, da-da-da. I just got home, and I just kept saying, man, I don't feel good. Then I picked up the baby, and I was shaking, and I couldn't hold her. And I was like, oh, my God, like, am I having a seizure? I'm like, what's happening to me? So I put the baby down, and I started having, like, shivers and chills, and I started ignoring Catherine's calls because she was like, what is going on over there? And I was like, I'm not answering her phone call because I know what Catherine's going to say. She's going to say, get to the ER. She knows I hate hospitals. She knows I would probably prefer to give birth at Publix. Like, she knows I do not want to go to the hospital. Like, I'm not doing this. And I'm like, I'm not going back there. I just left. I didn't even want to be there. And I knew that's what she was going to do. She called my husband. Don't know how that happened. And he's like, all I hear him saying is, yeah, yep, okay, got it. He hangs up the phone. He's like, you're going to the hospital. I'm like, what? I'm like, what are you saying? And I didn't talk to her for like a whole 48 hours. I didn't want to text her. I was so angry. My mother-in-law is a OR nurse. Well, she's a nurse anesthetist. But anyway, she's got years of experience. And she's like, yeah, why didn't you say something? I'm like, because I know you go to the hospital too. And so we went straight to the hospital. They ended up referring me to a cardiologist, and they caught things before everything got really bad. But what ended up happening there was my numbers were clear. And if somebody wasn't watching me, I would have definitely died for sure, because I was just going to go back to sleep. And because I was like, I'll just rest. I'm just tired. And I was like, because when I saw my number was 18, I was like, I'm just really sleepy. But that's the power of being able to monitor somebody remotely. So we're hoping to use this technology to be able to catch things like this, because if there was no normal that she could have compared that to, we would have known what to do with any of these numbers, really, right? It would just been like, oh, she probably just didn't sleep well and all these things. But if you compare it to the normals, it's like, well, there's got to be something going on. So some other signs of infection, which that's what also happened. I also had an infection, so I had like cardiac failures and an infection. I had 3 different infections going on at one time, and so we had to take temperature and all these things. But chills and shivering, I told you I was sweating like crazy. I knew all these things, right? I went to PT school. I took tests. I got A's, and but I just was like, that's not happening to me. So, but that's what ended up happening. And so these are signs that you need to be looking for in your clients and your patients for infection. These are typical signs, but they could have atypical signs. They could just not feel good. And so we need to take that very seriously. So one of the infection catches that we had was on one of our moms who just had a mild temperature. I mean, it's 100. But she kept saying everything was painful, everything was painful, everything was painful. And then she took a picture of her C-section scar, and one of the sides was raised. And that was a little bit abnormal. So she went back and they found out that it was in fact an infection. So just being able to kind of just catch little things, right? Because you think to yourself, you get told all the time, oh, you just had a C-section, of course it's going to be sore. So these things don't happen all the time. But sometimes we get home and things just don't go as planned. Everything is not, we're not recovering as we would like to. Here are some signs that a blood clot is blocking blood flow to the lungs, shortness of breath, chest pain, feelings of anxiety. These are some things that we've helped monitor against as well. Just kind of running through the list, kind of giving these mom a little pocket guide. Like, hey, look, if you have any of these things, you need to be thinking about blood clot. You need to be thinking about preeclampsia. You need to be thinking about infection. Okay, because sometimes that stuff is not educated very well in that 10-minute or 15-minute slot. You have the slot and they give you the paperwork. But if you don't know how to read the paperwork and understand it and apply it to your daily life, it's kind of like, I have to catch you on the next appointment if I even remember to ask you that question, right? So that's kind of what we're here for, and that's why those workshops monthly are so important as well. And then there's the Wells criteria, which is on this next side, is which we use to determine your risk for embolism. And so, of course, if it's higher than 4, then it's likely there's a blood clot blocking your arteries, and less than 4. I'm going to skip that part because we're getting hungry, right? But mostly the Wells criteria is very important. It can be used alongside these other resources that we've already received on the table as well for screening. Very quick screenings. They're validated. And it's very easy to see if they're at risk or not for a blood clot. Sometimes just taking simple steps can help save a life. So that's something that we just continue to push as much as possible. Reason things get missed is because blood pressure and heart rate are only taken at rest. I said this earlier. As a physical therapist, I get a chance to see people in action. And this gives me a better picture of their cardiovascular health. It gives me a better picture of their renal health. It gives me a better picture of how do they respond to their environment. Are they sensitive to light? Are they sensitive to heat? Because when you're in a controlled environment, we can't get any of this information, unfortunately. And I know that our healthcare system is set up in a way where we have to go to a doctor's office. That's fair. But if we can add people to our team, like a physical therapist or an occupational therapist or other rehab team members or mobility assessors or exercise physiologists, right, who are going to be able to test you in different arenas so you can kind of see how your heart does and how you feel after you do certain things, some of these things won't get missed. Equipment needs are not met. Like some of the things that we were talking about before, most people don't have a blood pressure cuff at home. Women are seen less than 3% of the time they are at risk for complications. So really over the course of the pregnancy, you might get seen 12 to 15 times. Unless you're high risk, right? If you're high risk, you get seen a little bit more frequently. But potential complications from near misses are just not being addressed as frequently, and other teammates are not being consulted. So here's how PT could help with the severe maternal morbidity situation that we have going on here. So condition during pregnancy, did you know that if you have gestational diabetes, that you have more 50% chance of developing diabetes later in life? And if you have preeclampsia, then you have 4 times the risk of heart failure and hypertension and 2 times the risk of cardiovascular disease or stroke. That's intense because we just heard that sometimes your risk of having a high risk pregnancy could lead to maybe even potential dementia, right? So what happens when you're 20 and 30, maybe even 40, if you're having a baby and during that time, it can impact your life a lot later. And so we need to be monitoring moms who have been identified as high risk, so that way we can continue to cut down the number of the mortality rate. And then if you had a forceps or vacuum assistance and had perineal tears, there's a 3 to 7-fold risk of having urinary incontinence and pelvic organ prolapse, which can also be helped by pelvic floor therapists as well. But at the end of the day, if that doesn't maybe present itself for another 5 to 7 years and we're not having these consistent follow-ups, then we're missing out on the opportunity to help somebody not have these issues. So this was put here because if there was a C-section, then your chances for DVT, I don't know if you guys can see this chart. Anyway, it goes up. Your DVT chances go up. Your pulmonary embolism goes up, stroke goes up, and then having a heart attack, it looks low, but it's not, because we just learned on that last presentation that it's not low. It's just low in comparison to 900 people over 1 million women in this study. So almost 1,000 women, they have their risk doubled of having these complications just because they had a cesarean, which most cesareans are necessary. Most emergency cesarean are necessary, and C-sections are not a bad thing to have. But if we already know that there's a risk for some of these things, then we can't discharge a patient that had a vaginal birth and a cesarean birth and then treat them the same way as they leave home, right? So 6 weeks, the checkup should look very different, because your chances are extremely high of developing one of these, especially if you have preeclampsia and gestational diabetes. And let's say you had a high-risk pregnancy, you had multiple gestations where you had twins or triplets. Now your chances are just getting higher and higher and higher to develop a lot of things. So just as PTs are contacted for incontinence and prolapse, we should also be contacted post C-section or hemorrhage or preeclampsia. And you're probably asking, well, how can a PT help me? Because you guys are thinking maybe my ankle's not broken, right? Or maybe my back's not hurting. Well, your back is hurting if you're pregnant, right? But really it's about positioning, transfers. You got to get out of the bed. After a C-section, they're telling you not to pull or push a certain amount of weight. And if you're coming up like this, you're pulling up your whole body weight. Nobody thinks about that. They're thinking about boxes, but we're not talking about boxes. You're pulling your body up to stand up. That's weight that you're not supposed to be pushing or pulling. And you're straining. So proper lifting techniques, pushing techniques. If you have another child, carrying techniques, okay? PT's helping all that. Positioning, so that way we're not hurting, our posture is not suffering. Because usually what happens with our posture when we get pregnant is we kind of concave the chest, and we have the posterior hip tilting back, right? So you got all this bad stuff happening on your back, and your core is weak. So PT can help in a lot of those ways. And so here's some more ways that we can help. So just being able to log roll over, right? So you might not even be able to sit up, right? So techniques to roll over and to be able to sit up like this in bed, stair negotiation, getting in and out of the car, right? These are talks that we're not having after giving birth. At least my doctor didn't tell me. If you guys are doing that, do it, continue to do it. But nobody told me how to get in and out of the car, right? So, and if you're in a car or you're in a truck, or you're in a van, right? There's so many different things that you're gonna be stressing your pelvic floor, your core, your back. You could really be injuring yourself internally and you don't know it. So some interventions could also include breathing techniques, coordination, fluid management, like massaging, just making sure that the swelling is going down, activity modification. So monitoring, what is your heart rate when you're cooking, when you're up doing laundry? Because if it's sky high, then maybe we need to do laundry sitting, or maybe we need to have somebody else cooking, or maybe we need to send you some DoorDash money to get you some food. That could be also an activity modification. Upper back strengthening, low back, pectoral, neck, and quad stretching because we're hunched over, and then abdominal, glute, and pelvic floor engagement. And not just Kegels, we're talking about true core engagement to just protect our organs that are inside. And you can have an easy PT session for uncontrolled blood pressure following delivery, because like I was just talking about, one of them is scar desensitization. This is not looked at a lot, but that really does happen. You can have sensory issues around that scar. I know my mom, she couldn't feel around her scar for almost a year because there was a nerve nicked when she was sewn back up. So just trying to get that back into motion, compression stockings, avoiding dependent leg positions like standing, having ankle pumps to help against like potential DVTs, and positioning. She put 2 ottomans and 7 pillows because that's exactly what happened. Like the lady was round sweeping and she couldn't sit down, and she didn't want to tell anybody why she couldn't sit down. It was because she was in pain. Because everything in her house was so low. Her bed, her chairs, all these things. So we had to set up the ottomans and pillows and things so that way she could finally have a seat. Because she was having, like, her stress was out of the roof, blood pressure was high, and we just couldn't figure out why. But it was just because she couldn't sit down. So just those little sessions, things that aren't going to happen in the doctor's office, just because you're not at home, right? So some things have to happen at home. Some conversations have to happen when you get home. You have to assess your living situation now after you've had a child. I'm going to skip this, and we're going to I'm just going to go to here because we've been talking about teammates and some other teammates to consider. Chiropractors, occupational therapists, kidney doctors, dietitians, social workers, doulas, dentists, pharmacists. Dentists are so good. I love dentists on this list because if you have dental issues or and you already have a high risk pregnancy, it actually hurts you later on in your pregnancy. A lot of people don't know that. Like if you need a crown or you had an infection or you need a tooth removed or you had your wisdom teeth taken out, it's like, that's major surgery. Okay, you're under for a little bit, or they numb you, or everything like that. It affects your fluid retention. It affects a lot of things. It increases your risk for infection. So dentists are really key members on a team during pregnancy and postpartum. Cardiologists, pulmonologists, respiratory therapists, PCPs, hematologists, endocrinologists, lactation consultants. Some women develop mastitis when they're expressing, and that can become a big deal. It can turn into sepsis. And so actually having a lactation consultant is very, very good to have on your team. Here are a few testimonials, support, peace of mind, and empowerment. But overall, if you want to be connected with Operation M.I.S.T, this is a way to connect. And I will now take a few questions. Here are the references, but I'll come back to this slide.
In the interest of lunchtime, let's take a couple questions and then talk to Dr. Quinn afterwards. And I hate to have to limit it. But
No, you're fine.
We're running a little behind.
Yes, I see. I saw it was 12:30. I was like, let me just skip to the end.
Couple questions?
I hate to stand between people a month, but I just want to give a little shout out. I'm Margaret Master. I'm the new executive director of Healthy Mothers, Healthy Babies Coalition of Georgia. We're strong partners with Operation M.I.S.T. But we also provide a perinatal care package, which includes a lot of the thermometer, the urine strip, but we're gonna add a tape measure.
Awesome.
A blood pressure monitor, a manual breast pump, and so that's one of our many projects, as well as a website with lots of great downloadable infographics you can use with clients and people that you see, because prenatal education and childbirth education and postpartum resources. Pickles and Ice Cream is the Georgia-centric, family-facing resources for all. I'd be happy to talk.
And if you want to
Okay,
send that information,
Yeah.
access that to us, we'll send it out. We've already promised to send out some things, so we can send out the contact information if you like.
And don't be scared to approach me at lunch. I'm friendly, so if you don't want to ask now, you want to ask during lunch, it's totally fine. Oh, there's a question.
Who pays for Operation M.I.S.T?
Great question. I'm going to give the best answer I can. Originally, the program did start with, I will say this, as I started as a participant and I did not pay to be monitored. But I think now the mothers do pay to participate?
So there is.
Or-
Yeah, there's grant funding.
It's grant funded, I know that, but I know that they also pay for, there's specific levels of monitoring that I'm privy to, that I know, that they do have I'll just call it a membership, but please call Catherine, because I do not want to misquote it, because I'm on the other end of it. I'm just a monitor, and I know that it's grant funded, and I know that we help like hundreds of women. And from what I know, I don't think that anybody's paying any money to do it, but yeah,
There's like 50 per county, there's certain counties that are identified.
yeah.
I know we had like 50 for this, 50 for Warner Robins, but there's other, neighboring, rural counties that
And
can
it-
as well.
Yeah, and it might be based off of income as well, just from, yes, no, yeah, I know some moms, I know that I've contacted, that we did talk about income-based options and things like that, but for the most part, I think it's just grant funded, but that's not the, please not quote me, stop writing. Thank you, guys.